Hi, this is Sophie here at Hope Pharmacy with pharmacist Sadaka Chow. Today's 10 questions are on Ambien, so let's start. Hi, Sadaka. What is Ambien and what is it used for?
Hi, Sophie. Ambien is a prescription medication used primarily for the short-term treatment of insomnia. It helps patients fall asleep faster and stay asleep longer.
Got it. And how does it work in the body?
It works by enhancing the activity of GABA, a neurotransmitter in the brain that induces sleep by inhibiting neuronal activity. It specifically binds to a GABA A receptor, leading to a sedative and hypnotic effect.
I see. What are the typical dosing recommendation?
The usual dose of Ambien for adults is 10 milligram taken once per night immediately before bedtime. For women and elderly patients, the recommended starting dose is 5 milligrams, as they are more sensitive to the drug's effects. Doses should not exceed 10 milligrams per day.
Got it. And what are the potential side effects?
Common side effects include dizziness, drowsiness, headache, and nausea. Serious side effects may include complex sleep behaviors such as sleepwalking and sleep driving, anaphylaxis, and severe allergic reactions. Patient may also experience next day impairment, especially if they do not get a full 7 to 8 hours of sleep.
I see. Are there any contraindications for using it?
Yes, it is contraindicated in patients with a history of hypersensitivity to zolpidem or any of its components. It should also be used cautiously in patients with a history of drug or alcohol abuse, depression, and respiratory issues such as sleep apnea.
I see. And how should it be taken to ensure safety and effectiveness?
It should be taken orally on an empty stomach immediately before bedtime. Patients should ensure they can stay in bed for a full night, 7 to 8 hours of sleep before taking Ambien. It should not be taken with or immediately after a meal, as this can delay its onset of action.
I see. Good to know.
Excuse me.
And can it be used long term for insomnia?
It is generally prescribed for short-term use, typically 2 to 4 weeks. Long-term use can lead to tolerance, dependence, and potential withdrawal symptoms. If insomnia persists, patients should be evaluated for underlying causes and alternative treatments should be considered.
I see. And what are some important drug interactions that pharmacists should be aware of with Ambien?
It can interact with a lot of other CNS depressants, such as benzodiazepines, opioids, and alcohol, which leads to increased sedation and risk of respiratory depression. It also interacts with drugs that affect the cytochrome P450 enzyme in the body, such as ketoconazole, which increases the ambient levels, and rifampin, a tuberculosis drug, which decreases the ambient levels.
I see. And what should patients know about the risk of complex sleep behaviors associated with it?
Patients should be informed that it can cause complex sleep behaviors, including sleepwalking, sleep driving, and other activities while they're not fully awake. These behaviors can occur with no memory of the event and can be very dangerous. If a patient experiences any of these behaviors, they should discontinue Ambien and contact their healthcare provider immediately.
Got it. Last question. What precautions should be taken when discontinuing therapy?
Abrupt discontinuation of Ambien after prolonged use can actually lead to withdrawal symptoms such as anxiety, agitation, rebound insomnia, and in severe cases, seizures. So to minimize withdrawal effects, Ambien should be tapered off gradually under the guidance of a provider.
Oh, okay. All right. Well, that's all I have. Thank you, Sadaka. Have a great day.
Have a great day.